Getting the COVID-19 booster is about doing our part to love and protect our families. Vaccines are a life-saving tool in the fight against the virus. Over time, they become less effective at preventing serious illness, just like other vaccines. We need the boosters to increase protection against COVID-19 and its variants, ultimately preventing us from getting really sick or dying. So do it for your family, especially those at higher risk. Protect the ones you love. Vaccinate.
Hello, everyone. Welcome to today's Inquirer Live Health Report, sponsored by Independence Blue Cross. I'm Letitia Stein, Health and Science Editor for the Inquirer. Today, I'm talking with Sarah Gantz, a health reporter with the Inquirer. Sarah, thank you for joining us today.
Thanks for having me.
Earlier this summer, a ruling by the U.S. Supreme Court eliminated the constitutional right to an abortion. The nation's high court overturned the landmark decision known as Roe v. Wade that for nearly 5 decades had ensured abortion was legal across the nation. The decision left it up to states to decide what is legal and when. About half of states already had laws on the books to reduce access to abortion, and about a dozen have enacted almost total bans on abortion since. Now, this is not the case in the states that compose the greater Philadelphia region, where abortion remains legal, but the fallout is still significant here. Sarah has been writing about how this decision is affecting patients and providers across Pennsylvania. Although abortion is a political issue of significant importance in the coming elections, her work focuses on abortion as a health issue. We appreciate the chance to discuss today what has been changing and not, and the status of healthcare involving abortion. Sarah, maybe we could start by, if you could just bring us up to speed on what is the legal status of abortion in Pennsylvania.
Pennsylvania, abortion remains legal in Pennsylvania. The federal decision didn't affect our access here right now. That could change in the future. But for right now, abortion remains legal through the 23rd week of gestation.
And the other states in our area, such as New Jersey and Delaware, are they any different?
Also legal in New Jersey and Delaware. New Jersey is actually one of the few states that codified the right to abortion, meaning that they put it in their state law that this is a right that people will have. And in Delaware, abortion is legal until the point of quote unquote viability, which is about the 20th week.
Interesting. So can you help us to understand in the most basic sense, what exactly is an abortion as a health and medical term?
An abortion is a termination of a pregnancy. This can happen for a lot of different reasons. It may be that someone is not ready to be a parent, or it could be that continuing with a pregnancy would pose a serious health risk either to the person who is carrying the fetus or to a baby that would be born. There are a lot of reasons that people may seek out an abortion, and I think it's important to keep that in mind, that even when people are making a choice for their life, it's not necessarily a matter of healthcare, life or death for everyone, but there are very serious ramifications for people who, for whatever reason, are unable to get an abortion, but also unable to support a child. It can affect the child's long-term health, the parent's long-term health, and also the mental wellness and stability of both, and also the financial stability of the families.
So there are also different ways to terminate a pregnancy or to have an abortion. What happens specifically in an abortion clinic?
I think the type of abortion that most people think of when we talk about abortion is a surgical abortion. A surgical abortion is either a D&E, a dilation and evacuation, or a D&C, a dilation and curative. And those are surgical procedures in which fetus and any other matters of conception are surgically removed from the body. What makes up a greater portion of abortions today are medication abortions. These are abortions that are early enough in the pregnancy that someone can take an oral medication that will end the pregnancy. This is usually done, well, in Pennsylvania, it must be done under the supervision of a doctor. Whether you are going to the clinic in person or having a virtual visit. If it's a virtual visit, the doctor would be on the other side of the camera on their computer, and they would watch you take the first pill. There's a second pill that's usually taken anywhere between 24 to 72 hours after the first one. So inside abortion clinics, they do surgical abortions that are not considered extremely high risk. A very high risk abortion you would need to seek hospital care for. And they also counsel patients who are seeking a medication abortion.
So then you've mentioned the concept of a medication abortion. That's an abortion that could take place at home as well. If it's not a surgical procedure, if you're doing more of the pill format or the medication format, that can take place outside of a hospital or a clinic or any form of a medical setting. Is that right?
That's right. There are some challenges with medication abortion through virtual care. This was an option that was really helpful for people, especially during the pandemic when we were not able to see doctors in person. There are still a lot of rules in Pennsylvania that regulate this. You must have a consultation with a doctor 24 hours before your procedure, whether that is a physical procedure, surgical procedure, or a medication procedure. You must take the pill in the presence of the doctor, either in person or again through video at home. And you must be physically in the state of Pennsylvania, the Commonwealth of Pennsylvania, when you take both pills. So that is having an effect on people from out of state who may be coming to Pennsylvania for care. It must be taken within the state boundaries.
Yeah. And I think you're starting to talk about this, but if you could perhaps expand. So abortion is legal in Pennsylvania, but are there restrictions? Are there regulations that might limit access?
Yes. What's interesting about Pennsylvania, or what I have found interesting about the reproductive care landscape in Pennsylvania, is that while abortion is legal here, there are so many restrictions that in parts of the state, it can be just as challenging to get an abortion here as it would be in one of the southern states that we more traditionally think of being conservative in their abortion rights. For instance, in Pennsylvania, everyone must receive counseling from a doctor 24 hours before your procedure, which for a lot of people means either traveling to the clinic 2 days in a row or having a virtual consultation and then going into the clinic. You also have to have a series of blood tests that, from what I understand from clinic managers who operate both in Pennsylvania and in other states, are tests that are not medically necessary for the vast majority of patients. These are tests that they order for their patients in Pennsylvania, but would not order for most of their patients in New Jersey, for instance. Blood tests and just common routine blood work type tests that aren't really necessary for this type of procedure. Another difference here compared to other states that restricts access is parental notification for minors. If you are considered a minor, you must notify your parents that you are having this procedure. And aside from the restrictions that affect patients, there are a lot of restrictions in place for the providers that limit where they can operate and has restricted how many providers are in the state. For instance, abortion clinics are required to meet building codes akin to an ambulatory care facility, like an urgent care center for medicine, even though the level of care that they provide is much, much less serious. There are rules such as the number of sinks that they have to have, how wide their hallways must be. There's even a rule about the size of the awning outside the front of their building. They are inspected twice a year, both for safety as well as building measures. These rules are, of course, intended to make sure that health facilities are providing a very safe and effective level of care. But providers argue that some of these rules limit the care that they're able to provide. One of the most significant rules that they point to is that abortion clinics in Pennsylvania cannot offer abortion care on the same floor as they offer other health services. So, for example, clinic that I've been to in Philadelphia, they have the space. They'll put the abortion clinic on one floor, and then the next level up, they have regular health services, and they're separated by a lobby area and an elevator. Clinics that don't have the luxury of a 2-level building are restricted to offering abortion and regular health services on alternating days, which limits how many patients they can see overall. This has affected the number of health clinics there are in Pennsylvania. There are a handful out here in the Philadelphia area. There are a few out in Pittsburgh, and in the middle of the state, which is a very big place. It's basically a desert. People in central Pennsylvania have to either travel hours to Pittsburgh or hours to the Philadelphia area.
That's very interesting, and that's where you get this concept that, as you noted and have written about, much of the state is almost as restrictive as parts of the Deep South, which is known for some of the most stringent abortion restrictions, even though it is technically still legal in Pennsylvania. It's interesting, and I think that the legality of what is legal and not is there's a lot of nuance to this. So could you perhaps just walk us through a little bit to this most recent Supreme Court ruling, which is known as the Dobbs decision? What did it say?
It basically said that the U.S. Constitution does not offer protection to people to guarantee them a right to an abortion. It said the decision should be left to the states. In other words, it should be every state's individual decision when and if people are able to access abortion care. As a result of that, many states moved to swiftly restrict abortion. Previously, they had no choice but make it accessible to people because there was a Supreme Court case, Roe v. Wade, which we all know, that mandated this. But the Dobbs decision overturned Roe v. Wade and set a new standard that there is no constitutional protection for this. Therefore, it is left to every state to decide. In Pennsylvania, we remain a state that has abortion access because there have been no laws passed to restrict it, and because there were no pre-existing laws that known as trigger laws that would have restricted access. That's just not the case in a lot of other states.
Yeah. And certainly some of the states around Pennsylvania are places that have moved rather swiftly to restrict access even further than, the restrictions and regulations that had been on the book prior to the Dobbs ruling. So how is that affecting Pennsylvania? Do we have residents from other states where abortion is now more severely restricted coming here? And what have providers been preparing for?
We do. Some of Pennsylvania's closest neighbors are states that either have or are expected to ban or severely restrict access. And that's going to have a big effect on the number of people seeking care in Pennsylvania. Ohio was one of the earliest states to restrict access. I believe their 6-week ban goes into effect in a couple weeks. Providers in Pennsylvania have seen this coming, and they are preparing for it. They expect as many as 8,500 more people coming to Pennsylvania for abortion care because they can't get it in their home state. The challenge is that if you look at a map and you look at the states that border Pennsylvania, if those states ban access, those people who need care have nowhere else to go because the states on their other borders also don't have access. So it creates a real crush of people trying to get care. In Pennsylvania, there has been a lot of pressure on Pittsburgh, which is the closest option for people in Ohio. I spoke with providers there last week, and they told me that they are seeing a significant increase in the number of out-of-state patients coming, to the point where they are encouraging patients from the middle of the state in Pennsylvania that would normally get appointments at their clinics to go east. Some of the clinics kind of in the outer central southern part of Pennsylvania are also seeing more out-of-state patients. Areas like York, Harrisburg, Allentown are starting to see more out-of-state patients. In Philadelphia, we haven't seen as many patients from places like Ohio or even West Virginia, but they are seeing a small number of people who are traveling to places where they may have friends or family that they can stay with. Texas, for instance, has some very significant restrictions to abortion, and it's such a large state, and the states around it also don't have access, that people there, if they're going to travel for an abortion, they're more likely than people in Ohio to be flying to get care, and they're flying to places where they have family or someone to support them.
Yeah, that's interesting. And certainly then we also have, sort of on the other end, New Jersey, where I think, there have been some significant efforts to, say very clearly that this is a state that will be protecting abortion access for anyone who needs it, if I'm understanding that correctly.
Yeah, that's right. New Jersey, like I said, is one of the few states that put it into law that abortion is protected. They've also established the state as what they call a safe haven state, meaning that when out-of-state patients come to them for care, they are not going to participate in any cross-state investigation into doctors or patients who sought care. This has been something that has come up where states want to not only restrict access, but they want some sort of legal ramifications for people who cross state boundaries to get care, or medical providers in other states who assist their residents. And New Jersey has said, we will not participate in that. We will not spend state funds to support those efforts.
Yeah. And so, when we talk about an abortion provider in an abortion clinic, one of the best known, of course, is Planned Parenthood, which is the nation's largest provider of abortions. You recently spent time inside one of their Philadelphia clinics, and you learned that there's more than abortion that takes place there. Can you tell us about the kind of health care that women are finding in abortion clinics?
Yeah, I think a lot of people may be surprised to know that a majority of the care that's provided at Planned Parenthood has nothing to do with abortion. It's actually healthcare that, if people have access to, can help them avoid an unintended pregnancy. On the lower level of the clinic, they have their abortion clinic where they provide abortion care. On the main level of the clinic, they have a health center where people can get their routine OBGYN checkups. They can get birth control. They can get an IUD. They can talk about family planning and get an STD test. All sorts of just general health care that is much needed in Philadelphia. When I spoke with the providers there, they told me about patients who have a private practice OBGYN that they see for their routine visits, but when they have a UTI or some other more emergent need and their doctor can't get them in for 3 weeks, they call up the Planned Parenthood office, get an appointment that week, and move on with their lives. And this is the type of service and care that the clinic provides that is critical in Philadelphia, where we have a shortage of healthcare providers and a big need for community level care.
Yeah. You've also spent some time talking to providers, the people who are the healthcare professionals in these settings. And this is an interesting specialty. It's almost a calling, I think, in the story that you wrote recently. But can you talk to us a little bit about the stories of the people who choose to provide abortions and what is involved in doing so for them?
Sure. One thing that I found really interesting when I talked to some of the providers and learned about why they chose this specialty. I mean, think about it. It's a profession where, it is routine procedures. It's work that is emotionally challenging, and many people go to work every day with protesters outside their building's front door, telling them that they're terrible people. It's a hard job. It's hard when your job is being legally challenged at the highest level court, suggesting that what you do and what you've invested so much time and energy training for and helping people with is wrong. What I think is interesting about abortion providers in Pennsylvania in particular is that because of the way the state's restrictions are set up, it's very difficult for providers to incorporate abortion care into a general OBGYN practice or an overall family medicine practice. People who choose to provide abortion care in Pennsylvania are making a very deliberate choice that they're going to dedicate their career to that. What I heard from the providers I talked to is that they came to this profession for a lot of different reasons. One woman told me that she wanted to be an OBGYN, but after seeing the harrowing experiences that women had in hospitals where doctors weren't trained in abortion care, she knew that this was something that she needed to do. Others told me that one woman told me that when her daughter was born, she remembers holding her daughter and thinking, geez, I was able to go to school, get my medical degrees, get my training, buy a house, get married, have my life together before I had a child, because contraception and abortion care was available if I needed it. And what if my daughter didn't have the same options? So I think that we have a tendency to think of doctors in a very sterile way, this professional person in a white coat. And talking to them really, I think, helped me better understand them as individual people.
That's interesting. And certainly also it's a real choice to do this kind of a work in general. What do we know about the people in Pennsylvania in particular who seek out abortions? Do we know anything about, who is being served by access to abortion and what might happen, of course, if that were to ever be reduced?
One thing that I found really interesting about the demographics of who it is that's getting an abortion is it's by and large people who have kids. It's not people who are just treating their lives frivolously and deciding, oh, you know what, I'm not ready for this kid, even though that is a totally legitimate decision too. But by and large, we are talking about people who already have children and who are deciding that they will not be able to provide the life that they want to provide for their children if they have more children. One of the doctors I spoke to recalled a scenario much like this. She had a patient who was very distraught about her decision to have an abortion because she felt bad about it. She felt guilty. She felt that she was going to be judged for not wanting more children. And through talking to the doctor, was able to work out that, it is a sign of love for her children and for her family to do what is in their best interest. And this was what she felt was in their best interest.
Could abortion ever change? Could the access ever change in Pennsylvania?
It could. Right now, abortion is legal. That's largely because we have a governor who is a Democrat who has committed to vetoing any legislation that would change the access that we currently have to abortion care in Pennsylvania. There is an election coming up this fall, a few months from now, in which the Republican candidate, Doug Mastriano, has been very clear about his intentions to support any abortion ban that were to come. If there were to be a Republican-led legislature with a Republican-led governor, it's feasible that access in Pennsylvania could change. Another consideration that people who follow these issues are keeping an eye on is a bill that made its way through session this past spring that would create a constitutional amendment that could set the stage for a future ban. And what that means is it wouldn't automatically ban abortion. Having this constitutional amendment wouldn't ban abortion, but it would open the door for there to be legislation passed that could ban abortion. This is a type of thing where they passed it in this last session. If the same bill were to get through a subsequent session, it would then become a ballot measure on our ballots for all of us voters as early as next spring.
Whenever we talk about healthcare, there's also the question of cost, right? So, sometimes the government pays for certain kinds of healthcare, for example, Medicare for seniors or Medicaid for certain households that qualify based on income. With abortion, how is this paid for?
Abortion is generally not covered by insurance. There are some private plans that do, but it's not considered a service that insurance plans are required to cover, and therefore a lot of them don't. That would be the same with any other health service. If it's not required to be covered, lots of plans just don't cover it. In some states, including New Jersey, Medicaid can pay for abortion. That's not the case in Pennsylvania. So by and large, people are paying out of pocket for abortion care, and it can be very expensive. There are a lot of so-called abortion funds, which are basically nonprofits that raise money for the sole purpose of helping people afford this care. An abortion, depending on the type you get, can cost hundreds of dollars or thousands of dollars. If you have a surgical procedure that requires anesthesia, it could cost thousands of dollars. This is a huge barrier for people. That disproportionately affects people who are already low income. This is where those funds really come into play. A lot of the clinics also work with patients to get them the care they need on a sliding scale based on what they can afford.
Yeah. It's interesting between the political landscape and the financial and logistical pieces involved. I imagine that there'll be quite a lot for you to explore in the coming months around a healthcare issue that, as you noted, is the health pieces of this are have been it's not new medicine, but it is an issue that remains fresh and new in terms of how the medicine is available to people in this country, and in particular in our region. Sarah, thank you for joining us today at the Inquirer's Live Health Report, sponsored by Independence Blue Cross. We really hope to see all of you with us again next time. And please, to read more about Sarah's coverage, visit inquirer.com/health.